So in our previous lesson about the flow fraction, we looked at the formula and made some distinctions, important distinctions between home hemo patients and in-center hemo patients. And the reason we need to do that is because it will directly affect how we use the flow fraction. What we're going to do in this tutorial is use the concepts of the flow fraction and home hemo patients, apply them to the in-center patient, and learn why the flow fraction and writing a prescription for a home hemo patient is drastically different than an in-center patient. In other words, we're actually going to write an incorrect in-center hemodialysis prescription based on home hemo principles so that we can illustrate why there's a big difference in what we have to take into account when we write prescriptions for either home patients or in-center patients. So let's look at this home hemo patient again. What we said in the prior lesson was that there are certain parameters we fix as physicians, we dictate, and there is another parameter that is dependent on all of the parameters that we dictate. What we want is a KT over V, so we tell our machine the KT over V we want. We tell the machine what the blood flow is going to be. That's based on the patient's comorbid conditions. And we tell the machine what the dialysate flow rate is going to be, because we have a limited amount of dialysate to use as a result of limited space in a patient's home. We also tell the machine what the flow fraction is by virtue of telling them what this is and what this is. It's just a ratio of dialysate flow over blood flow. And what we don't tell the machine, what the machine tells us is the time. How long is the patient going to be on the dialysis machine per session at home? So let's now take these parameters and apply them to the home hemo patient. Excuse me, the in-center patient. So let's put an in-center patient here. An in-center hemo patient. His basic demographics are as follows. He's a man, and he's 70 kilograms. We're going to say the KT over V should be about 1.4. That's based on the hemo study results. We set the blood flow, and generally it's 400 mLs per minute. That's what you see in most dialysis centers. We're going to set the dialysate flow rate based on our filtration fraction. So we're going to say the filtration fraction is 30% or 0.3. Hence, we multiply these two together and we have a dialysate flow rate of about 120. And we're not going to set the time. We're going to let the machine tell us how long it'll be for the patient to achieve all of these parameters. So let's plug it in some numbers into the formula and let's see what we get. So this is an in-center patient, but we're using the concepts of home hemodialysis to see where the error is. In-center patient who has a KT over V of 1.4. We said in the prior lesson that the KT over V is just the filtration fraction times the drain volume divided by the volume of distribution. So we know what the filtration fraction is, and we know what the volume of distribution is. Plug in the numbers. We have this one already, and we're going to get the drain volume. So we're going to say that the drain volume is equal to about 196 liters. Okay, so we have a drain volume of 196 liters, and that drain volume is primarily the dialysate. We are not counting ultrafiltration for the sake of simplicity. We know that the dialysate flow rate is 120 mils per minute because we set our filtration fraction at 30% and we set our blood flow rate at 400 mils per minute, and we know that the filtration fraction is just a ratio of these two flow rates. So if we take our drain volume, multiply that with our dialysate flow rate, we're going to get this time. It's going to take 1,633 minutes to go through 196 liters of dialysate if we want to achieve a KT over V of 1.4 and keep the filtration fraction at 30%. This is the same as 27 hours on the dialysate machine. Completely impossible to do when you have an in-center patient. Completely impossible to do when you have a home hemo patient. So let's look at what we've done and where we made our error. Why is the home hemodialysis prescription using the flow fraction incorrect when you write an in-center hemodialysis prescription? So to do that, we'll clear this. We're going to have to go back to our graph. This is a clearance of urea or any substance, we'll say X. And in the previous lesson I said that this was the dialysate flow rate because we are keeping the blood flow rate the same. The curve that you're about to see here, which is the same curve we saw in the prior lesson, is true if the x-axis is the dialysate flow rate or the ratio of the dialysis versus the blood flow rate. In other words, the filtration fraction. As long as we keep this the same, it doesn't matter if we just use dialysate flow rate or filtration fraction. Now, what did we do in the in-center patient? What do we normally do in an in-center patient? In an in-center patient, what we normally do is we define the KT over V, we define the blood flow, and we define the time, because this is what's most important to us. We cannot have a patient sitting on the dialysis machine in-center for a long period of time. We say the time should be set anywhere between 3 or 4 hours. And we tell our machine if we want to achieve a KT over V at a particular blood flow, and we can only keep the patient on the dialysis machine for 3 to 4 hours, then what we want you to do is figure out how much dialysate flow is required. In other words, how much filtration fraction is needed. You're typically accustomed to seeing dialysate flow rates of about 800 mils per minute. In other words, you're typically seeing a filtration fraction of about 2, much higher than the filtration fraction of 0.3. This is 2, which is the same as 200%, and in home hemo patients we see 30% filtration fraction. Where are we on this graph when we're looking at an in-center patient? We're somewhere out here. We're somewhere in this area here, getting no additional clearance for the filtration fraction of 200%. Why do we keep a filtration fraction so high if we're not getting any additional clearance? Because we only have 3 to 4 hours of time in the in-center setting. Now, in the home dialysis patient, things are a little different. In the home dialysis patient, we cannot keep the patient out here. In other words, we cannot have a filtration fraction of 200% because we don't have enough dialysate to use to achieve the same things that we're getting in-center. In the home patient, we set the KT over V, we set the blood flow, but we don't have enough space to use an infinite amount of dialysate flow. So we set the dialysate flow. In other words, we set the filtration fraction. We tell the dialysis machine, don't put us out here, put us somewhere between these 2 points, because we need to get the maximum amount of clearance for the least amount of dialysate flow. Now, it helps that a home hemo patient does not need to achieve the same KT over V as an in-center patient. Home hemo patients need about 0.42 per session. Remember, home hemo patients do anywhere between 5 or 7 sessions a week. In-center patients need a KT over V of 1.4, predominantly because they only do 3 sessions a week. So this higher frequency of dialysis helps the home hemo patient. It helps us in writing our home hemodialysis prescription. What we do is we set the dialysate flow rate or the filtration fraction, and we let the machine tell us the time. And usually the time is anywhere in the order of 1 to maybe 2 hours, sometimes 2.5 hours, which is certainly not enough dialysis time to get a KT/V over 1.4, but we don't need that. We just need a KT/V of 0.42, and we don't have to achieve this KT/V at a maximum dialysate flow rate or maximum filtration fraction, because we can get that same KT/V anywhere down here. So because the home hemo patient, one, needs a lower KT/V, which is related to the fact that they have more dialysis per week, and two, does not have the ability to store large volumes of dialysate fluid, we have to write our prescription using a flow fraction and letting time be a dependent variable. When you go to the in-center patient, all we need is a KT/V of 1.4 and a time that's fixed between 3 or 4 hours. And we tell the machine you can use as much dialysate flow or volume as you need to achieve this KT/V at this blood flow in this amount of time. That's where you get the 800 mils from. That's where you get a filtration fraction of 200%, and that puts you up here on this curve. So it's all about what you're setting on the machine. If you're setting time, if you cannot be flexible with time, you're going to be using an in-center prescription, and you're going to be somewhere out here. But if you cannot be flexible with your dialysate volume or flow rate, then you're going to be setting a filtration fraction, and you're going to be somewhere in here. And that's the main difference between a prescription in-center hemo patient and a home hemodialysis patient.